speaking to Conor Martin, who is a registered mental health staff nurse in our Trust Psychiatric Inpatients Unit, Bluestone. Morning, Conor.
Morning, Paula. How you doing?
Great, thanks. Conor, Bluestone is a really lovely modern building here on the Craigavon site. Can you tell us a bit about the services offered from there?
Yeah, so Bluestone provides inpatient mental health and learning disability services for the whole of the Southern Trust. So we offer that through the multidisciplinary teams within each of the wards. So we have an over 65 ward mental health, and we have a learning disability ward called the Dorsey Unit, and then we have 4 acute inpatient wards: Bronte, Clockmore, Silverwood, and Rosebrook, which I work. So an acute inpatient ward is probably the most well-known and used type of ward in adult mental health. So just we cater for a wide variety, particularly within the age group of 18 to 65, and all comprehensive sort of care within the varying mental health conditions that are treatable here within the unit.
And Conor, I know you're quite newly qualified to your profession. Can you tell me a wee bit about what made you get into nursing and specifically mental health nursing?
Yeah, well, it's sort of 17, 18 when you start making those decisions about what you want to be when you're a wee bit older. Nursing certainly wasn't at the forefront of my ideas. It's sort of, you could speak to different guys around the unit, different men. A few of them worked as plumbers, barmen. You know, it's sort of a full circle type to go back to the sort of mental health nursing role. But I've always had an interest based on personal experience growing up as a carer, specifically in intellectual disabilities. And I was initially drawn to learning disability teaching, primarily probably due to July and August and the holidays that come with it. But at 17, 18, I didn't really have the understanding of what mental health services are out there, and then what the role of probably a psychiatric nurse was. So with more life experience and then working within supported living services part-time when I was in university, it sort of catered for that sort of understanding of learning disability and mental health services. And then I was more drawn to probably the mental health aspect of it because I found it was more interesting, particularly providing support in a sense. And it gave me a good insight to pursue it as a career and maybe go back to university at 21, 22 and go on and do my mental health nursing through Queen's. So I can certainly see it now, being a staff nurse, the sort of importance of maybe being, you know, a male within the unit, whether that be opportunities or whether that be just for the gender dynamics. So, you know, it was definitely a good decision to go back to university, and it certainly is a career that at 17, 18 years of age, you really have no idea what's it all about. But as I said, the more life experience you gain, the more understanding you get. And that's probably why we see a lot of older students, whether that be through Queen's, Jordanstown, or even Open University, with that back end of life experience, come back and do mental health nursing as a degree and as a career.
Brilliant. Conor, can you tell us a wee bit about the nature of the patients and the conditions that you would see and treat and support in Rosebrook?
Yeah, so Rosebrook, which is the ward that I work on, is a psychiatric intensive care unit. So we provide specialist care, assessment, and comprehensive treatment to individuals experiencing probably the most acutely disturbed phase of their serious mental illness or the disorder. So most patients are admitted to our service from the other acute wards, or they're admitted directly from the community or from maybe forensic services or PSNA custody suites. So we're a 10-bedded unit, so we're a lot smaller than the other wards, which have 18 to 20 bed capacity. So, but we're back with a full complement of nursing staff, social work team, medical team, occupational therapy, and we have also a lot of healthcare assistants here as well. So we treat a large spectrum of mental illness, most commonly probably schizophrenia and drug-induced psychosis is quite prevalent at present. However, each of the patients are treated, you know, patient-centered, and you know, when we get to know them, probably due to the 10 beds, that we get to know our patients inside out, and we have a real focused and comprehensive treatment plan for each one of them. So that also helps induce sort of rapport that we can develop with patients. And you know, it's a good environment in the fact that it's low stimulus, and it just supports them in going back over to the open wards and just helping them along in their recovery. So it's probably the most interesting aspect I find of nursing, psychiatric intensive care side of things, because you are dealing with probably, as I said earlier, the most disturbed. And for me, only being newly qualified, it's probably a good baptism of fire to get in and sort of see severe and enduring mental illness. So every day is a learning day, and every day is sort of like very much interesting. So I'm happy to be here in a sense.
So Conor, you're not actually treating patients for COVID, but COVID must have had an impact on your ward, like it has right across all of our services over the past year. Do you want to tell us a wee bit about your experience?
Yeah, so certainly COVID, in effect, has been another sort of complex layer on top of mental health. Insofar that social distancing is probably a large problem because it's hard to maintain, and at times we do need to place physical contact and have that physical contact with patients. And also the masks, wearing a mask, it just adds another layer onto that sort of rapport building and therapeutic relationship, because they can't really see your face. And facial expressions are a massive thing. They're sort of something that I never really thought of until you start wearing your mask and you have to try and explain things to patients and sort of build their trust, and they can't really see your face. So they have been big challenges, but the patient group within Rosebrook have been fairly good in the fact that we're doing COVID tests regularly. And we have been explaining the different principles of COVID, and they've been quite agreeable towards visiting times and stuff. So that is very difficult. And I think the staff here do empathise with the patients insofar that visiting arrangements can be quite difficult, especially when you're in a mental health setting, in effect to promote recovery and maybe to see their families and stuff. But no, we're a resilient and adaptable bunch in here. So, COVID, yes, it has been a large stumbling block and a roadblock towards many services and stuff, but we're still operating away, and we're sort of looking forward to it all ending and maybe getting a good night out at the end of it.
Very good. Conor, I imagine because the nature of your work, your working environment must be emotionally challenging at times. Can you share what you do in your downtime to unwind?
Yeah, so I think in a sense what can't be overlooked is probably the fact that I live a distance away from the unit. So getting in the car and I think driving home is probably one of the most therapeutic things I can actually do. Because by the time I get home, I forget about whatever day I had. But when there's spare time, I do live in a small farm. So I farm with my brother and my father. So, that keeps the mind occupied. I did play football towards like a high level. So I had to sort of knock that in the head once I started nursing due to the long hours, the late evenings. So getting exercise in as much as I can has been fairly beneficial. And I suppose having a good support network too, in effect that family, I have an older sister who's a senior social worker within Dublin. I have a younger sister who's an adult student nurse, in Liverpool. So I'm sort of caught in the middle between, a student nurse and a social worker. So I'm in the right place if I ever need some sort of reassurance or guidance along the way. So I definitely do think that having that sort of family to bounce off and, sort of listen to any concerns that I may have has been very good. And I also think that the team in here, we're quite a close-knit group. And, we all go through the same sort of challenges. We all deal with the same patients and the same workload. So, that is, it's quite a good factor to have as well as your work colleagues to bounce off too. But no, I'm happy enough farming and trying to get as much exercise as I can. I'm probably catching up on a wee bit of socialising now when things are opening back up. So that's certainly the plans for the next few weeks ahead. And
Lovely. Sounds good to me. Conor, it has been really nice speaking to you this morning. Thanks for your time. And I'm thinking maybe you'll inspire some of those who are out there considering a career in nursing.
Definitely, because I know, and from speaking to the other guys in the unit, that if there was that sort of push on maybe trying to get men into nursing, it could go a long way. And I think it's just about raising awareness for the job that we actually do, and what the job role is. Because at 17, 18, as I said earlier, it'd be quite off-putting to come out forth and say, I'm going to go on and be a nurse. So I definitely think more education around it will certainly help insofar going a long way.
Brilliant. Thank you, Conor.
No worries. Take care. Thank you.